Okay, hello everyone. So my name is Ivan. I'm from the Hong Kong U team. So today I'm going to introduce our project on the Odyssey APAC community, this study number 2, titled The Comparison of Mortality and Morbidities and Healthcare Resources Utilization Between Patients with and Without a Diagnosis of COVID-19. I'm sure you're all aware of the large number of cases and deaths caused by the COVID-19 pandemic worldwide, and as well as the respiratory-related illnesses caused by this virus. But beyond the respiratory-related illnesses, there's been reports of association of both short and long-term complication involving other organ systems with COVID-19 infection. And hence the rationale for conducting this study to generate further evidence to understand the short, medium, and long-term outcomes following COVID-19 infection. So the objectives of this study is to monitor and evaluate the short, medium, and long-term mortality, morbidity, as well as the use of healthcare resources following COVID-19 infection, as well as to investigate the adverse outcomes of COVID-19 infection in specific populations, including children, elderly, and patients with multi-morbidities. So this project, in this project, we'll conduct cohort studies using multinational healthcare databases, and we'll be comparing the outcome of interest between subjects with COVID-19 and without COVID-19 during the study period. And the short, medium, and long-term outcomes will be defined as those occurring after 6 months, from 6 months to 1 year, and between 1 to 3 years of COVID-19 infection. So here is a brief illustration of the design of this project. So those with a positive COVID-19 diagnosis during the inclusion period will be included into the COVID-19 case cohort, and those with a negative COVID-19 diagnosis matched to the subjects from the COVID-19 cohort will be included into the non-COVID-19 comparator cohort. Subjects from both cohorts will be followed for up to 3 years to evaluate the short, medium, and long-term outcome. So the outcome of interest includes all-cause mortalities, a series of morbidities, including but not limited to cardiovascular, respiratory, hepatic and renal, immunological and neurological diseases, and malignancy. And in terms of the use of healthcare resources, we'll be interested to investigate the attendance of outpatient consultation, allied health visits, accident and emergency department admission, 28 days hospital readmission, any diagnostic tests, as well as the length of stay per episode. We aim to include healthcare data from multiple countries in our analysis, and hence we would like to run our study on the Odyssey platform. Currently, we are planning to include data from the Hong Kong Hospital Authority database, as well as several of these IQVIA databases from the US and European countries. If you would like to get involved, either as a data partner or in other ways, then please do get in touch with us. And one important note to mention is that we perfectly understand that there's quite an exhaustive list of outcomes we have mentioned. If your data set doesn't cover all of those outcomes, we would still like to welcome you on board to take part in part of this study. So if you would like to find out more about this study, or you would like to join us, then please feel free to get in touch with us. Here are our contact details, and thank you very much for listening. And that's all from me. Thank you.